Hello, everyone. Now it's time to talk about the immunologic drugs or immunomodulation drugs. So the part one will deal with NSAID, steroids, and other small molecule drugs that are used to treat immune disorders. In this video, we will focus on NSAIDs and steroids. It will cover learning objectives 1 and 2. So the types of immunologic drugs are summarized in this slide. So you can basically characterize all the immunologic drugs into 3 groups. The first group is anti-inflammatory drugs, drugs that can reduce inflammation and pain. These include NSAIDs, corticosteroids, and the second group is immunosuppressive drugs, drugs that control unwanted immune responses. Again, corticosteroids falls in this group because it has a broad spectrum of functions. In addition, this group of drugs include calcineurin inhibitors, cytotoxic and anti-proliferative drugs, as well as biologic drugs, which include poly and monoclonal antibodies, cytokines and cytokine inhibitors, and fusion receptors, and we'll cover that in the next class. And the third group of immunologic drugs are either immunostimulants or they can be called immunomodulators. So these are the drugs that can stimulate or modulate abnormal, either high or low immune responses. So in this video, we will focus on NSAIDs and corticosteroids. So NSAIDs stands for non-steroidal anti-inflammatory drugs. So most of these are over-the-counter medications that you can buy without prescriptions. So these drugs, the NSAIDs, can be either non-selective inhibitors of both COX-1 and COX-2 enzymes. So COX means, it's an enzyme, cyclooxidase, in the synthesis pathway of the inflammatory mediators. So these non-selective inhibitors of COX, either COX-1, COX-2, include aspirin, ibuprofen, naproxen. So we're all familiar with these names. And it can be also COX-2 selective inhibitors, and which are specific to COX-2 enzyme. So basically, NSAID, the function or mechanism of action of NSAID is to block COX, the cyclooxygenase that synthesize, as I mentioned earlier, the inflammatory mediators, mostly prostaglandins or PGs. So these drugs are usually used to reduce inflammation, relieve pain, and reduce fever. So actually, these effects appear to be mainly through the inhibition of COX-2. Although the effects can be through COX-1, but it's mostly the effects on the inhibition of COX-1 cause the adverse effects, the major adverse effects, including the GI discomfort, renal impairment, and liver disorders. So these are all seem to be caused by the effect on COX-1. And in general, the non-selective drugs are give more severe side effects than the selected drugs, which is not that hard to understand. So I'd like to just mention that although there are COX-1 and COX-2 involved in the pathway of the synthesis of inflammatory mediators, COX-1 is predominant as compared to the COX-2. So aspirin and ibuprofen are two examples of commonly used NSAIDs. So aspirin is acetylsalicylic acid, and it's a non-selective COX inhibitor, means it blocks both COX-1 and COX-2. So clinically, it is used to reduce pain, fever. It has anti-inflammatory effects, and also it helps to reduce the risk of developing heart attack. And the major adverse effects include GI discomfort, GI bleeding, renal impairment. However, overdose can cause poisoning. So let's take a look at ibuprofen. Its trade name is Advil or Motrin, we're all familiar with. It's a propionic acid derivative. So, like aspirin, it is a non-selective COX inhibitor. And clinically, it is used to reduce pain, fever, and it also has anti-inflammatory effects. Just like aspirin, it has a similar potency as aspirin. Although aspirin also helps reduce the risk of heart attack. So ibuprofen, just like aspirin, has also similar adverse effects, although it has fewer adverse effects as compared to some of the other NSAIDs. So a third example of the commonly used NSAIDs is acetaminophen. So the trade name is Tylenol, and its chemical name is called acetaminophenol. So acetaminophen is highly selective inhibitor of COX-2, and this is from recent scientific findings. It reduces pain mainly by blocking COX-2 in the central nervous system, and it has very limited peripheral anti-inflammatory activity. So clinically, it is used to prevent pain and fever as comparable to aspirin and other NSAIDs. And as I mentioned, it has very limited anti-inflammatory activity, and so generally it's not considered as a true NSAID. And overdose can cause fatal liver damage, and also it can cause rare but possibly fatal skin reactions, such as toxic epidermal necrolysis. So before we go on with the next group of drugs, the steroids, I'd like to remind you the major steps of immune responses and the potential drug targets. That is the sites of action for immunosuppressive drugs. So if you can look at this figure, and I have simplified it to 5 major steps, 1 to 5, from antigen processing presentation to step 5, T and B cell activation, differentiation, and proliferation. And for each of these 5 steps, there's a potential target that can be used as a potential target for immunosuppressive drugs. For example, we talked about corticosteroids, which can affect the step 2. So next, so we are going to talk about corticosteroids, and then in the next video, we'll be focused on steps 4 and 5, talking about the small molecule immunosuppressive drugs. So let's look at this first class of immunosuppressive drugs, the corticosteroids or glucocorticoids. So these steroids are naturally made. They include cortisol, corticosterone, and in fact, over the last number of years, synthetic derivatives have been used to treat immune disorders because of their a lot higher affinity for the receptors and low salt returning properties. So the efficacy of the drug is, for the synthetic derivatives, much higher than the naturally made steroids. So these steroids have very broad and potent effects on multiple components of the cellular immunity. So it can have anti-inflammatory effects, anti-allergic effects, and immunosuppressive effects. So the mechanism of actions of these steroids are to regulate genes that, for example, NF-kappa B, that is involved in the T cell signaling pathway. And therefore, the downregulation, for example, of NF-kappa B can reduce the T cell signaling and thereby inhibit T cell differentiation proliferation. In addition, these steroids can also repress other genes involved in the inflammatory responses. And therapeutically, these steroids are often used in combination with other immunosuppressive drugs to treat GVHD, autoimmune diseases, inflammatory and allergic disorders, and it is frequently used in organ transplant rejection. So here is a list of examples of such steroids. So this slide shows the mechanism of action of the corticosteroids or glucocorticoids in general. So basically, it's involved in transcriptional regulation of genes. And I'm not asking you guys to remember this, except that these steroids, they're hormones. They do not act on the cell surface receptors, but they diffuse into the cytosol and bind to specific receptors in the cytoplasm, and then the receptor sterol complex translocate into the nucleus and find its target genes to regulate them. So in fact, about 1% of total genes in a cell can be influenced or regulated by these steroids. So on the right side of this picture, this slide, it shows that the gene regulation property of these steroids can reduce the expression of FKB, which in turn increase the apoptosis of activated cells, and then which also reduce the production of interleukin-1, 6, and TNF-alpha. And you probably remember these three cytokines are very important for the inflammatory process. In addition, the downregulation of NF-kappa B also reduce the production of interleukin-2 and therefore reduce the activation of T cells and differentiation of T cells, and which lead to the reduction or inability of T cells to become the effector cells, for example, the cytotoxic CD8 T cells or CTLs. And also, this effect can reduce the production or the maturation of neutrophils and reduce the chemotaxis, so neutrophils and other granulocytes cannot be attracted to the site of injury or inflammation. And because of the effect on T cells, the antibody production was also reduced. And the result will be like anti-inflammatory, anti-allergic, and immunosuppressive. So this table just shows, summarizes the anti-inflammatory effects of corticosteroids or glucocorticoids. On the left side, it shows the activity, direct effect on the release or production of a number of cytokines as shown here, which in turn reduced inflammation caused by the inflammatory cytokines and the mediators. Another example of its anti-inflammatory effects is the downregulation of phospholipase A, which is involved in the production of or synthesis of inflammatory mediators, prostaglandins, and leukotrienes. So, and of course, there are other effects that are also contribute to the inflammatory process, and these effects are also downregulated by these steroids. So because of the broad spectrum of their functions, these steroids also have like a broad spectrum of adverse effects of long-term use and higher dose use. These include adrenal insufficiency, growth retardation in pediatric patients. Osteoporosis is a very common side effect, weight gain. It can also promote the development of cataracts and glaucoma. It can induce diabetes, and it can increase cardiovascular risk factors, and also it makes patients more susceptible to infections. Another adverse effect is that it can change the patient's personality and making them like more irritated and angry. So this is the figure I already showed you before when we talked about, the hypersensitivity reaction, the type 1. So this is the mast cell degranulation and synthesis process. And we talked about, the anti-inflammatory activity of NSAIDs and the corticosteroids. And I just want to give you a summary of showing the NSAIDs target the oxygenase in the pathway of the synthesis of inflammatory mediators, prostaglandins, and leukotrienes. And then corticosteroids can downregulate the upstream component phospholipase A2 in the synthesis pathway. So now I'd like to give you a couple of examples of these steroids. The most commonly used glucocorticoid is prednisone or prednisolone. So prednisone is a prodrug for prednisolone. So it's basically converted to prednisolone in liver. So prednisone is usually worked in combination with cytotoxic drugs. We'll talk about that later. So it has, again, just like other corticosteroid hormones, it has a broad immunosuppressive effects. It can promote the lysis of antigen activity T cells. It can suppress T cell proliferation and sequestering of T cells at the extravascular locations and reduce interleukin-2 production and T cell responsiveness to interleukin-1. So clinically, prednisone is used to treat many immune disorders like autoimmune disorders, asthma, and it is also commonly used in transplant rejection. And the major side effects of prednisone is the Cushing's syndrome. So basically is disproportional distribution of fat on patient's body, and including moon face, a really round face, osteoporosis, growth retardation in pediatric patients. Also, long-term use of prednisone can make the patients more susceptible to infections. It can also cause a number of other side effects like myopathy, cataracts, glaucoma, glucose intolerance, fluid retention, to name just a few. So another commonly used glucocorticoid anti-inflammatory drug is hydrocortisone. It is a lot less potent than prednisone, and it has a few immunosuppressive effects. It can inhibit the synthesis of inflammatory mediators, as I pointed out earlier. It can suppress the infiltration of phagocytes and therefore reduces swelling, redness, and pain. Clinically, it's mostly used for dermatologic disorders, either orally or topically. So the major side effects of hydrocortisone are a lot less severe as compared to prednisone because of its low potency. So basically, the major ones are thinning of the skin and easy bruising, local hemorrhage, and acne after long-term use. So there are a number of other glucocorticoid steroids, such as betamethasone, dexamethasone, and they are usually very potent steroids, and they don't have salt-retaining properties. And usually these drugs are used to treat inflammatory conditions such as allergic disorders, some specific type of skin disorders, and autoimmune disorders if prednisone does not seem to work well. So I have put a little bit information about other types of other examples of these corticosteroid hormones in the study guide. So please look at the study guide for the information, for this information. And we will continue in the next video with the small molecule immunosuppressive drugs. I'll see you then.